Now, from the government point of view also, and from the population point of view also, sadak, bijli, pani, roti, kapda, makan. Okay, so these were the priorities. Even population also was expecting this much. Okay, so that's how when you are expecting that much, then you are provided with that much. When it comes to now, people are demanding about the education. They are demanding about the healthcare. So even government is proactive.
Hi everyone, welcome in the next talk powered by Game of Pharma. Today we have with us a very special guest, Mr. Sujeet Katiyar Sir. Sir is the digital health expert, rural health expert and founding member of MediPocket and many other projects related with the digital health. Welcome on the show, sir.
Thank you, Mr. Lokesh, for having me.
Can you tell us a little bit about yourself, sir?
First of all, for me, it's been around 22, 23 years into healthcare technology. And I have been trying with many kind of things, right from the digital health, the tele health, the rural healthcare, using technology, regulation and compliance. I have been like advocating it since long, but now even government of India, because previously we used to look at all the GDPR and the HIPAA, okay, to make it like how it can be better solution. So that's how I have been trying, and right from the rural healthcare to the cross-border care. Because when we say the telemedicine, the definition wise, when patient and doctors, they are distance apart. When they are distance apart, then why there should be any limitation? So we are going even beyond limit. We are going to overseas, like wherever the best doctors available. Because in India, though we have a scarcity of doctors, but as far as the specialty care is concerned, challenges are even more. Scarcity is more. So, in case of specialty care, we are looking at US, UK, other European countries. So, we are starting in one project. We are starting with US doctors from all the leading hospitals and institutions.
Sir, in today's era when everything is getting digital, why not healthcare? Like there are some steps taken in healthcare like telemedicine and pharma, but that acceptance from the users, from the patients is not yet that much that could be. So, what do you think are the major obstacles that are the journey to make healthcare more digital and better?
I'll partly agree with what you said. As far as the other industries, right from the edtech, the fintech, the e-commerce, adoption is more. Okay, so it's not always like okay, one is responsible for that one. Though as far as the internet connectivity is concerned and all the device availability is concerned, so slowly, gradually, things are improving. Okay, it's not like telemedicine is just because of pandemic or it's just started. It was there, but adoption was not there from all the ecosystem partners. Okay, it's not that we should hold responsible to the doctors or hospitals. It was from all the side. Now, because of compulsion, everybody has adopted it. So the challenges are again in the rural area. If we talk about all the, because we are having certain projects going on in the rural area also. So yeah, internet connectivity is there. 97% of our villages, they are connected right now. But when it comes to the upload speed, it's not that good, I'll say, because this download speed when you're using all the YouTubes and other social media or anything like movies, if you can, you want to watch the movie online, you can. But when it comes to the upload, when we are doing the video consultation, then there are like challenges. Still, there are challenges. Then comes the language part. That's again very important. We need to have the solution which should be either very simple language point of view or it should be in the local language, because it's healthcare. It's not just you are having some idea about the thing. It's the exactness when you are telling, explaining about your symptoms. So pain is like can be described in 10 different ways. So if you are not aware like how to communicate, then it will be very challenging for the doctor to prescribe you right medicine. And then comes the UX part. Okay, everybody can use WhatsApp, everybody can use Facebook. So why we as a telemedicine solution provider or any kind of technology solution provider, we should be following similar kind of or even better UX, keeping in mind that we are not designing it for somebody who is very well versed, like people like us. Okay, if we are given any kind of application, we'll operate it. Maybe we'll learn it quickly and we will operate it. But this we cannot expect from the masses, like because this is going for the masses. Okay, so any solution we are developing. So what we have been doing, like we are getting inspired. I won't say copy. We are getting inspired by something which is successful there in US, in China, in Japan, in other developing country, and we try to create some replica or some similar kind of thing. So this habit needs to be improved. Like we need to design certain things which are like easily adaptable and localized. Localized, like what kind of solution already our audience they are using. Okay, so similar kind of things. So these are the obstacles, but during the pandemic and till now, things have improved a lot. Okay, because here when we talk about the startup things, okay, be it anything, it's like 10%, 30%, and the rest 70%. 10% all the big metro cities, 30% is again the urban, the another bracket, and then the 70% is the rural part. Okay, so usually all the startup things, whether it's a grocery thing or whatever, 10 minutes delivery, that's very much common these days, but it's limited to what? 10%. Okay, then they look for the 30% area. Then comes the 70%. Okay, so now things have reached to the 70% as far as healthcare is concerned. Okay, now we need to like make it more affordable without compromising on the quality thing. So that's how I can see, like previously hardly 10 to 20% doctors they were using. Now I think 10 to percent 20% are remaining, which they are not using right now. So it's a really good growth. And again, last but not least, the regulation part. Okay, because when you have certain areas where things are not clear, okay, so certain doctors they are a bit hesitant. Like government is neither allowing nor stopping. So many people they prefer not using. Okay, so now when guidelines are there, regulations are there, then they are like, okay, now legally and otherwise we can use it. So there are many things, but I'll say I'm very hopeful. Things are improving at a very rapid speed.
Like a startup also like funded recently, which is a 8 minutes ambulance services, and
Right.
which is growing in mostly in the tier 1 cities. But I think what we need is कि ये गांव में villages में ज्यादा rural healthcare में ज्यादा grow, because like 8 to 10 to 14 to 20 minutes की ambulance service तो tier 1 cities में easily available हो जाती है. But like in the rural healthcare we need कि वहाँ पे ये services applied हो, so that the major mass of the population of India will also like get these help of these startups.
Right. I'll agree. Look, still now from the government point of view also and from the population point of view also, sadak, bijli, pani, roti, kapda, makan. Okay, so these were the priorities. Even population also was expecting this much. Okay, so that's how when you are expecting that much, then you are provided with that much. When it comes to now, people are demanding about the education. They are demanding about the healthcare. So even government is proactive. Okay, the recent many developments like these many today only I was reading somewhere it's 9,000 crores in one event which was like in Ahmedabad. Okay, first day our PM was also there. So and that time he launched Ayush Visa. Okay, some special channel visa that one can get for the Indian system of medicine treatment here in India. Okay, so it's a medical tourism which he was talking about. So there the 9,000 crores it was allocated, like many who joined and they shown the interest and the expression of interest was submitted. So that's how slowly, gradually, but again When it comes to the rural part, okay, so there has to be some sponsor of the things. The affordability is a big challenge there. Okay, when it comes to like why tier three cities are not having good hospitals. Okay, so when you say from the other side, so it's like usually it's some 20-25 lakhs per bed, which costs to for this one. So until unless you are not having good inflow of patients, it's a not sustainable model. Okay, to work over there because quite a few they tried and they failed. Okay, so until unless government is not like helping them some uh, some tax benefits or some other kind of benefits, if they are not offering, there is a hesitation. So that's how digital health is a lot better. There, what we can have a very small setup. Okay, with which we call the physical also or assisted telemedicine. Okay, so which we are adopting in the this rural healthcare project. So because you cannot force doctors to go to the this one rural part. Okay, and again the 70-30. 70-30 means 70% or even 80% doctors are in 30% urban area. Okay, and there are again many reasons for that. The children education and the infrastructure and everything. So, but having said that, even government has been trying in many ways. They are opening that they are converting PHCs into health and wellness center. Okay, so PHC is a very small kind of setup with very limited kind of health facilities available there, and then immediately you need to shift to the district hospital, the CHC part. Okay, so but again, in this way, there is lot of inflow there in CHCs. Okay, load is more because you should capture the patient where you should at a very starting stage. So nowadays it's like only district hospital. You should either go to the district hospital, the AIMS, the PGIs. So that's how they are having a lot of load. So if you are having better facilities at a lower level, which government has been trying because they are having, I think, target of some 1,50,000 this health and wellness centers opening, and these are going to have, in fact, this digital health also, from where they are connecting to the district hospitals or the other better hospital. So that's how even they are adopting. But being a such a hugely populated country, it's not that easy. Okay, so but government has been trying.
Like sir already told, there's a major gap between the urban cities and the rural areas in terms of healthcare. So आज भी अपने like locate से practically we even see this when we visit our villages कि कोई झोला छाप, नॉट झोला छाप बट उसकी डिग्री कोई और है, किसी ने बीएससी कर रखी है, किसी ने कुछ कर रखा है, एंड दे आर प्रिस्क्राइबिंग मेडिसिन टू एवरीवन एंड पीपल बी लाइक कि डॉक्टर साहब हाँ बहुत अच्छा दवाई देते हैं, हम 2 दिन में हम ठीक हो जाते हैं, एंड व्हाट दे आर गिविंग कंप्लीटली स्टेरॉइड्स एंड ऑल. तो इसको काउंटर करने के लिए सर वी ऑब्वियसली वी नीड रूल्स एंड रेगुलेशन, सो व्हाई आर वी लैकिंग इन दिस?
That's a really big challenge, and that's again in the absence of, because I think in last year 2021 around November December some report was there. So I think it was like 1,500 locations of the three locations somewhere they studied. It was like usually these kind of locations they are having 3 doctors, and out of 3, 2 are non-qualified. Okay, so that's how it, because here in India, as far as the patient doctor ratio is concerned, that's bad. And again, this 80% doctors in 30% area. So that's how it's opening the place for them. Coming to the regulation part, again, to complete that thing, this government is in process of starting the medical colleges in all the districts. We are having somewhere around 800 districts or so. So they are in process of starting medical college in all the districts, at least one medical college. Okay, so a medical college that comes with the hospital. So of course it will give some access to in the districts where right now medical colleges are the bigger size hospitals are not there. Then comes to the regulation part. Regulation part, rather than why it is required, in absence of this thing, everybody is free to work with whatever way they are exposed to, whatever they are working. Uh, I doubt you'll be aware about like before 2020, I think March 25th or so. Before that, any kind of online consultation was illegal. It was illegal. Again, I'll repeat. So why? Because in absence of any guidelines, any regulations, any act, all the judgments pronounced by the honorable court, they become law. Okay. So in this process, I think in the year of 2014 or so, one judgment was there from the Maharashtra High Court. Okay. So Mumbai High Court. So in that judgment, it was very clearly mentioned, like until unless doctor is not physically examining the patient, doctor cannot diagnose, and until unless doctor cannot diagnose, doctor cannot or should not be prescribing. Okay, so it was very clear. Though it was like related to any particular case, but it got generalized, and again, it was very difficult for many doctors to provide the online consultation because it was illegal. It was illegal. So that's how when you say it, in the absence of anything, it's a gray area. Like this online pharmacy, it's been there since long. Okay, e-pharmacy, but there were not a guidelines there. Okay, same with the telemedicine thing. There were not guidelines. Now there are guidelines. Okay, so otherwise, like prior to this, suppose somebody like I'm like going for the consultation, and I say I don't want to disclose my details, my personal details. I mean, I don't want to share my name. Just I will tell my problems, and you prescribe this thing. Okay, so this is called the anonymous consultation. Okay, so which is in very few countries it is allowed. Okay, maybe some psychological, some sex related problems, or something which you don't want to share, and you are not like, okay, I don't want to reveal my identity. But prior to this the telemedicine practice guidelines, it was not clear to anybody. Okay, so in absence of any regulations, you are free to choose based on your intelligence, your exposure, and whatever you see this is going on, even I'll follow that thing.
Okay, you have discussed about like online pharmacy and these things. Like, so according to your point of view, the new healthcare startup will be a game changer for the healthcare.
Yeah, will be game changer because I am like associated with few organizations. They are helping startups. Okay, right from for a very brief period, I was part with the NESCOM and BIREC. Okay, so they are helping startups funding and in the execution also. Even right now, also I'm associated with some 2-3 startups.
Okay.
What is the thing like startups? They think out of the box. Okay, because why the bigger organizations, they are not thinking something which is very innovative, because they are having good resources, they are having good intelligence staff and everything, but it's not very easy to tweak the model, to change the business model. But in case of startups, they are very much free for these kind of things. Okay, they study the problem very closely. Okay, and they are limited to any particular thing. Like in telemedicine, I'm associated with one startup which is only talking about the cancer. Okay, the anything and everything you will get on one platform. Okay, at the same time, we talk about any very big name, say Practoa, M-Fine. Okay, so they are targeting the entire, like many specialties, like 20, 50, 100 specialties they are targeting. So they cannot create that kind of ecosystem. They cannot create that kind of support system in case of that the cancer related this thing. So that Oncobody is there. So that startup, right, all kind of knowledge base, all kind of support system during this thing and post any surgery, anything. So what all things are required, everything you will find there, everything. So that's how, because they are working in a very, very niche problem which they are addressing. So that's how they can address, and yeah, they try to find out the problems. Okay, where are some gaps are there? So that's how they are addressing it, and so it's a lot of help there for the end user.
एडमिन सर, जब अपने पास में डिजी लॉकर जैसी सुविधाएं हैं, जहाँ जहाँ पे हम अपने आधार कार्ड, सारी आईडीज को रख सकते हैं, तो हेल्थ केयर के अंदर में क्यों नहीं है? आज भी जब हम डॉक्टर के पास में विजिट करते हैं तो लॉन्ग लिस्ट ऑफ प्रेस्क्रिप्शन, पुराने बैकडेटेड प्रेस्क्रिप्शन, रिपोर्ट सब कुछ लेके उसमें उलझ के ये आगे पीछे करके शो करते हैं. सो व्हाई कांट दिस बी इन ऑर्गेनाइज्ड वे, जहाँ पे हम ऑनलाइन सब स्टोर करें एंड वो डायरेक्टली हम अपॉइंटमेंट से पहले ही डॉक्टर को सेंड कर दें, सो दैट उनको पहले से एक बेसिक आइडिया हो जाए अबाउट माय डिजीज.
Government is already working on it. Okay, so under this NHA, National Health Authority, there is one authority constituted by the government under Health Ministry. So they are working with this project since last many years. Okay, and right now many telemedicine or digital health service providers, they are like getting the solutions from there, and they are becoming partner with NHA. Okay, so what is happening there? All because the basic, if we think about like how data can be transferred to others, like I'm visiting any hospital or doctor, and then I'm visiting another one. So how data will be shared? So there need to be certain guidelines, rules. Okay, and with whose permission it should be. So it's not that easy. Like any particular, like if you are visiting to say Apollo Hospital in one in one city, and if you are going to any other city, yeah, they are having system in place since long. They can access the data because that's the same organization having same kind of technology, same kind of software using. But when it comes, you are talking about the entire country and many doctors, and they should be using. So there needs to be certain rules, the guidelines, which has been laid down. Okay, everything is there. Okay, so that's how what government has done. They have created a registry. Okay, registry because they I'm sure you'll be aware about the ABHA ID. Okay, some ABHA ID, some unique ID which they are assigning to the population. And second comes to the every doctor or healthcare professional, they are having something, some ID they are given. And last, health facilities. Okay, so this health professional, anybody and everybody is like which is either interacting directly with the patient or otherwise, like all the technicians, all the paramedics, they comes under health professional. And all the health facilities, be it a hospital or a clinic or a blood bank or a technology platform. Okay, so they will come under the health facility. Okay, so that's how they are creating very good system, and there they are having something called consent manager, because this is I think the only system in the world where everything will happen post consent of the patient. Okay, otherwise in many countries it's like, okay, the insurance company, they own the data. Okay, the data generated is owned by them. Or in certain countries where universal health coverage is there, the data is owned by the government. Okay, so that's how here it's like fully dependent on the patient. Okay, I'll tell you how it works. When you are visiting any hospital or any doctor, rather than telling other details, you just need to tell your ID or address. They are giving some address also, because address mean this Sujeet at mymedipocket.com. That's very easy to remember, very easy to convey. Rather than if I am reading out some 14-digit number, it's very difficult. Okay, so they are offering both the things. Using that, like suppose if you are coming to my hospital and then you say ki, this thing is Salman at NDHM. Okay, so Salman and NDHM, then you will receive OTP on your mobile phone that Sujeet Katiyar's hospital wants to access your information. Okay, if you want to give the access, tell this 1 2 3 4 5 6 this OTP to him. So you will tell me the OTP, and that's how I will access your personal information, which are required for the front desk. Right? In a hospital, when you go for this thing, जैसे आपको पर्ची बनवा के लेके आओ, get admission करके ले लो. So that kind of information will be accessed by them. Your name, date of birth, address, whatnot. So that information will be accessible. Okay. So this is the first part, and then comes the data part, as you mentioned, like we need to carry all the previous records, all the reports. Then when you are sitting in front of the doctor, so that time again you will receive another OTP, and there, like suppose if it's OPD, you are just consulting this thing, or you are going for the IPD, like you get admission. So there also, like in case of OPD, doctor needs to access your information for a very limited period, right? Because here data can be accessed for a limited time, and you cannot store the data. Okay, you can just view the data, like what was the thing, and then on that basis you can make the note, and you can proceed with the current problems, and then the prescription and other things. So in this process, the hospital or the doctor will get access to your previous records. That previous records, all the your diagnosis, the prescription, the pathologies, so everything can be accessed. Okay, so the technology used is a federated architecture. Okay, so it's not any centralized. Normally, what we see, like all the data is stored on a one center place. Okay, and everybody is accessing from data from there. Okay, so there are pros and cons of the centralized, and federated means distributed. Distributed means like I'm having the hospital, and I'm having my software solution. So I'm storing data on a particular server. Same way I can continue.
So thank you so much, sir, for the podcast, sir. It's been a great conversation, sir, and we learned a lot. Thank you so much, sir.
Thank you. Thanks for having me.